Good evening, everyone. I want to thank Abrar for that kind introduction. And I want to thank all of you for being here to support the Compassionate Care Network, CCN, and its good work. From primary and preventive care to trauma care, it's really important for our residents to have access to a wide spectrum of health care services. These residents must have access to resources that ensure their health, treat diseases, and help them heal and thrive after complex injuries and illnesses. CCN's network provides this kind of support for access to our most vulnerable populations. I know firsthand how essential and challenging this work can be. Our own Cook County health and hospital systems have seen tremendous change as a result of the passage of the Affordable Care Act. Federal health care reform has been a godsend for us, that is the health and hospital system, and more importantly, for our patients. Thanks to the ACA, hundreds of thousands of people in Cook County were able to sign up for health care coverage. Insured patients now comprise a majority of those cared for by our health system, with nearly 70% of our patients having coverage. That's up from 45% in 2013. Some 160,000 people are covered by County Care, Cook County's Medicaid managed care program that provides comprehensive coverage at almost no cost to eligible county residents. For many of the people who got their coverage under Medicaid expansion, with or without federal subsidies, it was the first time in their life that they had health insurance. Today, these individuals have access to important primary and preventive care services that are keeping them healthy. The Compassionate Care Network has seen the tremendous impact of ACA as well, finding new opportunities to assist their members by helping them enroll in newly available health insurance plans, both public and private. Groups like CCN have been vitally important to the success of health care reform in this country. The main goal, of course, is to expand access for at-risk and uninsured individuals. I want to commend CCN and its more than 200 healthcare providers, including primary care doctors, specialists, imaging centers, and labs, who have opened their private facilities during the past 10 years to provide a medical home for uninsured patients in Cook County and other parts of Illinois. Well done. Despite national health care reform, there are still an estimated 900,000 people, almost 1 million people in Illinois, who do not have health insurance, and a majority of them live in Cook County. 1 out of every 3 people who receive care in our health system remains uninsured. As many of you know, one of the unfortunate aspects of the Affordable Care Act is that it excluded the undocumented, and that's a large portion of the uninsured population that we serve and perhaps that you serve as well. These folks are family members, their friends, their neighbors, who have to worry about whether or not they will have the money to get the care that they need, who worry that if an unexpected medical emergency arises, it will deplete their life savings, and who worry about affording their prescription drugs and still be able to pay their rent. I'm proud to say that the Cook County Health and Hospital System is developing a new program to empower uninsured residents to provide access to health care services in our health system. The program, as you heard, will provide a structure for uninsured members to see a doctor they know and trust so they can stay well, keep medical conditions in check, and rely on hospitals only for serious illness. This will benefit not only the 40,000 uninsured people in the health system that the health system expects to serve in the next year, it will also benefit the whole of Cook County by promoting health and wellness and keeping our workforce healthy and productive. In developing this program, we received support from the Cook County Healthcare Task Force, Commissioners Gaynor, Garcia, and Steele, and community organizations such as your own Compassionate Care Network, which was a vital part of our effort to secure this new legislation. I'd like to thank you for the good work that you did on behalf of members of our community and your community. I appreciate not just the boots on the ground that you offer, such as health screenings and education programs, but also your advocacy on key public health issues, such as gun violence, behavioral health, water quality, and access to care. I want to thank everybody who supports this organization and who serves this organization for providing care for those who are most in need in our community. Thank you very much.